Let's talk about the general management steps of psoriasis. The first thing you want to do, you want to make a confident diagnosis and you want to assess the severity of the condition. Find any triggers such as drugs or any physical triggers and avoid those. Educate the patient about the disease and provide psychological and social support. That is the initial step. And then you will want to prescribe him some topical medications. That is the part of the next step, giving topical medications. The skin is often dry and itchy, so give emollients. Tars and ditronol also helps to relieve the skin irritation and relieve the keratosis. You can also give the topical vitamin D analog, which is the calcipotriene, or topical retinoids, and even topical steroids. So the second step is topical treatment, which is emollients, tar, ditronol, topical vitamin D, topical retinoids, and topical steroids. So step 2, topicals. Step 3, you want some specialized dermatological interventions. That is the step 3. Step 3, the 3D. 3 is the dermatological intervention. What you can do, you can give UVB or you can use excimer laser to decrease the burden of the disease. You can cut the disease portions. That is the excimer laser. You can also use what is called PUVA, which is a combination of Zoralen and UV spectrum A. Zoralen and UVA, that is PUVA. So those two are the specialized dermatological treatment, which is the step 3. Step 4 is the 4 systemic steps. Now you have to start giving systemic therapy. And beyond step 4 and beyond, all are systemic therapy. So what you can give methotrexate starting from 10 to 25, up to 25. You can also give cyclosporine, or you can give acitretin, which is the vitamin A analog given systemically. So that is the step 4. Step 4 is the systemic therapy. And if one of those drugs doesn't work, then you can change the drug, or you can consider the step 5, which is using apremilast. And if apremilast fails to control the disease, then that is a resistant case. And in this case, you have to go for biologics. So stage 6B or step 6B is the biologic. 6B is a biologic. And the biologics you can use are TNF inhibitors such as infliximab, adalimumab, or etanercept. IL-12 inhibitors such as ustekinumab, or IL-17 inhibitor 17 for secukinumab. So those are used for resistant cases, and hopefully they will be able to control the disease. So if I review, initial step is proper diagnosis, assessment of severity, identifying trigger, avoidance of trigger, give education, give psychological support. Then apply topical treatment, emollient, tar, ditronol, also give topical vitamin D, retinoids, and steroids. That is a topical treatment. And then specialized dermatological treatment, 3D, UVB, excimer, and PUVA. Doesn't work, go for systemic treatment in the step 4, methotrexate, cyclosporine, acitretin. Doesn't work, go for apremilast at last. And even that doesn't work, even apremilast doesn't work, go for biologics. TNF inhibitors, infliximab, adalimumab, etanercept, IL-12 inhibitor, ustekinumab, IL-17 inhibitor, secukinumab. That's all.